Member for Kelowna Mission.
Thank you, Mr. Speaker. Well, we've heard a flood of stories of people who have had to wait unbearably long hours for an ambulance. The government says it doesn't happen that often, but to the people who are waiting in excruciating pain, it's happening far too often. Troy Clifford, the head of the Paramedics Union in BC, says the delays and waits are becoming the norm. And I quote, "We need to modernize the service delivery model, recognize this profession is vital to public safety and healthcare, and recognize the professionals doing the work and treat them similar to other healthcare professionals," end quote. Seniors shouldn't have to wait hours in their own waste. Accident victims shouldn't have to drive themselves to the hospital after waiting 5 hours. And no one wants to hear that the Premier wants to deflect blame. Can the Premier tell British Columbians what he's going to do to fix this crisis in our healthcare system?
Minister of Health.
Well, thank you very much. And what we've done since 2017 to address the situation amongst ambulance paramedics, I think, should be well known to the member. We've more than doubled the increases the ambulance service gets every year compared to the 4 years prior to my becoming Minister of Health and the Premier becoming Premier. We've added, since last fall, 263 positions, and as of July 2nd, 434 additional positions will be posted based on a plan that we worked together with the union, with QP Local 873, the ambulance paramedics of BC, on a contract we negotiated together. Of course, every time someone calls 911, we need them to get the service they deserve, and every time there's a problem with that, it's a subject of concern for every ambulance paramedic and for the BC Emergency Health Services. And that's why we put together an unprecedented investment. We've added an unprecedented number of ambulance paramedics. And yes, we've treated ambulance paramedics with respect. Rather than taking away their right at the bargaining table, we've added to those rights since 2017, treating them as other healthcare workers are treated, with respect and with dignity.
Member for Kelowna Mission, supplemental.
Thank you, Mr. Speaker. Well, despite the minister's urging that more money is being spent, more money is not the answer for mismanagement. Troy Clifford has been clear that mismanagement has been leading to these delays becoming the norm. And I quote, "They have an obligation to staff ambulances and put 2 paramedics in them to make sure we have enough dispatchers to answer the call, to make sure that we can provide medical assistance while they wait for the ambulances." That's not happening right now. It hasn't been happening for a while, end quote. In my area of the province, the problem of vacant cars, it's posing a serious challenge. And this includes no advanced life support for the Okanagan 2 nights a week for a few months now. In other regions, stations like Kimberley and Pemberton are being downgraded to part-time and on-call despite increases in population and calls. This is putting people's lives at risk. So again, to the Premier, when will he move to fix this crisis before someone pays a heavy price with their life?
Minister of Health.
Well, Speaker, since the pandemic began, we've added 55 ambulances across BC, particularly in rural and remote communities who were particularly underserved before. Since the pandemic began, we've added 5 new air resources to our ambulance system to improve services, again, in rural and remote communities. Since last fall, we've added 260 plus ambulance paramedics positions, and we are posting more than 400 on July the 2nd. We've done this because of the priority we give to the ambulance service everywhere in BC, moving to more full-time paramedics, hundreds of new positions, and all of the efforts we're making are necessary because we do have to modernize the ambulance service into the 21st century. Some of that work, it should be said, occurred under the previous government, particularly the actions of George Abbott when he was Minister of Health in adding community paramedicine, which stabilized the ambulance services in rural and remote communities. And we have built on that work, the best that was done, but also added resources that were never put in place to ensure that rural BC gets the ambulance service it deserves, and that we add ambulance paramedics everywhere in BC. The member wants a plan. There is a plan. That's why we're adding hundreds of positions.